us a little bit about yourself, so a little bit of history.
I'm Dr. Mitchell Matez. I've been a physician for approximately 30 years. First 15 years of my career was dedicated to general surgery, and the second 15 years has been dedicated to anti-aging and age management type modalities.
Okay.
I'm currently the founder and director of the Boca Raton Center for Age Management in Boca Raton, Florida.
Okay, very nice. So what exactly is hormone replacement therapy?
Hormone replacement therapy is a therapy whereby we replace the sex steroid hormones of the human body, such as testosterone, etc., that dwindle as we age. They decrease as we age, and there are other medical conditions that create situations where people lose their hormones. What we do is replace them back to normal or natural levels in order to aid the bodily functions that hormones are responsible for.
Okay. All right. That's pretty descriptive. Now, in your FAQ, we saw something called bioidentical hormone. Can you describe that a little bit?
Yes, bioidentical is actually a made-up word. It's not necessarily found in medical texts. What bioidentical means, or is supposed to be, is a hormone that is molecularly identical to the human hormone, meaning the molecule itself of the hormone is the same as that in the human body, so that the human body cannot distinguish between its own hormone and the one you're giving it.
Okay. So who would you say that bioidentical hormones are right for?
Anybody who is having signs or symptoms of low hormone levels would be a candidate for hormone replacement therapy with bioidentical hormone.
Okay. So how do bioidentical hormones differ from the more traditional hormones that are used in mainstream medicine?
As I mentioned, a bioidentical or molecularly identical or human identical hormone has the exact same chemical structure as the hormones that are in our body. That's as opposed to most of the currently marketed FDA type approved hormones that are either animal derived hormones with molecular structures of animals or chemical structures that are invented by men and obviously patented and marketed. And that would be the main difference right there.
All right. So how are these hormones administered?
There's a number of different ways you can administer hormones. Here we really concentrate on two of what we consider to be the safe ways to give hormones, and that would be through the skin with creams so that they're traveling directly into your bloodstream. And then, of course, we use hormone pellets, which we plant underneath your skin, again, with a direct route into your bloodstream.
Okay. What exactly are hormone pellets?
Hormone pellets are tiny, cylindrical, approximately saccharin to rice grain shaped hormone pellets that are actually compressed hormone. They are pure, and they are actually planted underneath the skin, and they dissolve at a very, very steady rate and level for a period of up to 4, maybe up to 6 months at a time.
How are hormone pellets different from other forms of hormone replacement therapy?
Well, the major advantage to hormone pellets as opposed to all of the other potential therapies is the steadiness of the level. When we are younger, our hormone levels are quite steady all the time. All of the other methods of delivery yield an up and down type of a hormone level phenomena, whereas pellets yield an incredibly steady high hormone level.
All right, great. So are there any side effects to hormone therapy in general?
There are side effects to anything that you do. However, with bioidentical hormone replacement, the side effects are very minimal and actually very transient. There will be occasional side effects when you start therapy, but they are all self-limiting, and to the best of my knowledge, there are no long-term side effects.
So how long will the therapy take to start kicking in, start working?
Well, that's going to vary from individual to individual. Some people are going to feel better within the first few weeks, and others are going to need months to work at it. it is a work in progress to get to the right levels and balance in some people. I think the answer to your question is going to be somewhere between a few weeks up to a few months.
Okay. So how often will I need to come in if I'm getting this therapy?
Well, if you're on pellet therapy in the beginning, the first year, you'll come rather frequently till we get you to good levels in balance. And then, depending upon your own individual pattern, somewhere between every 4 to 6 months usually.
Okay. So do my other health problems or medications that I'm taking, will they affect this?
Very rarely. We will obviously have a rather lengthy conversation about you and your health problems before we treat you, but there's very few contraindications to treatment with hormone replacement therapy.
Okay. So will I lose or gain weight on hormones?
Well, no, the whole idea is to lose weight. Testosterone in particular is the anabolic hormone of the human body. Inadequate levels of testosterone will prevent one from losing weight. So if you have good hormone levels balanced and you eat properly and exercise, you will lose weight.
What kind of symptoms do I need to have before I start considering hormone replacement therapy?
Well, virtually any of the signs or symptoms of the aging process, of which there are a multitude, and you can, if you check on our website, there's a checklist of symptoms that are associated with these processes. I would say the three biggest that bring people in the door right now are probably lack of energy, lack of libido, and per your former question, a lack of adequate weight control. Those seem to be the three biggest, but different strokes for different folks. There's a lot of symptoms that are getting people as they're getting up there in age.
Great. Well, thank you for answering our questions. And,
My pleasure.